prepare a speech because I guess I really don't have one. But I would like to stand and say, and I was trying to think which vein I wanted to come from, because I can come from my faith-based vein, or I could come from the vein of working in the inner workings of providers and knowing how you have to try to interact to get approval to get anything done for a patient that needs care. But I think the one that's most strongly upon me right now, the one that strikes my heart chord, is I'm coming from the place of a daughter of a laborer. He was a union laborer. He was a bricklayer that worked in our community for many, many years. His name was Sanders Hillsman. He raised us all and made sure that we were provided for throughout our years. Never did we go hungry, never did we lack anything that we needed. But my father became ill, and with that illness, he kept thinking it was arthritis, and he was older. He had reached the age of 60, and because he was only 60 years old, he wasn't quite on Medicare, but he was getting so old, he was getting older, and so he couldn't necessarily keep up with the younger guys anymore as far as the bricklaying was concerned. So he found himself without work without health care coverage, and he was concerned about his bills. Therefore, he would not go to the doctor to see what was wrong with him. He kept thinking it was arthritis, so he kept getting Bengay and rubbing on himself. Well, until it got so bad that he couldn't do that anymore, we finally convinced him to go to the doctor anyway. And what we found out is he had bone cancer. And the thing that strikes me now is the fact that he was so worried about not having the money to pay for the care that he needed, to see what was wrong with him, that he wouldn't go. And because he wouldn't go, the cancer spread. And by the time the cancer was found, it had already spread throughout his entire body, and we only had a short time with him before he was gone. So my urgency now, or where I'm coming from now, is the fact that, yes, we need health care justice. Yes, we need it now. Yeah. We can't wait on a bipartisan to decide that it's important enough to them that we have the justice that we need, because parents are dying. My father doesn't know my sons, because he died before they reached the age of adulthood where they could benefit from the wisdom that he had. My daughter's son doesn't know my father. Lineages are cut off. Why? Just because he was afraid to go, because he didn't have the money that he thought he needed to go. What do we need?
Health care.
When do we need it?
Now.
Thank you.
Thank you. All right.